We interrupt your regularly scheduled programming to bring you breaking news. 25-year-old railroad worker Phineas Gage of Vermont fell victim to a freak accident while on the job. He was packing sand with a tamping iron when the charge exploded and shot a 3-foot rod through his head. The rod, weighing in at 13 pounds, entered his left cheek and exited the midline of the skull. Gage lives on. No reports yet on his prognosis. Here's a clip. I'm here with Dr. John Harlow, the doctor that dealt with the curious case of Phineas Gage. Now, Dr. Harlow, welcome. Why was this case so interesting?
It was so interesting because he was able to walk immediately after the incident and communicate sensibly. Also, he survived an injury of this magnitude, which is impressive in itself.
Interesting. Now, there were lots of reports of serious changes in his personality, such as newfound fitfulness, irreverence, use of profanity, obstinance yet capriciousness, and he began forming many plans only to forget them. Can you explain this behavior?
Yes, this is because there was damage to the frontal lobes, which are involved in higher level thinking, so that resulted in the changes in personality.
It's amazing that he even lived. Was it a quick and easy recovery?
No, definitely not. He had a hemorrhage which was bleeding profusely internally and externally, and the bed was just soaked with blood. Also, fragments of bone were being uplifted and the brain was protruding, and a portion of the anterior superior angle of each parietal bone and a piece of the frontal bone were fractured.
And how did you treat such a unique case?
We basically removed some of the pieces of the bone, dressed the wounds, and checked his pulse regularly.
How is his outlook? Do you think he'll survive much longer?
Considering the injury, he has a good chance of surviving, but there are pieces of bone that will have to be removed if he wants to live.
Thank you for coming.
Thank you.